show up.
Oh, we're on. Okay.
Yeah, you're on live. I just want people plug in.
All right.
Person join.
All right. Welcome, everybody. Come on and join us.
Okay. So far.
Welcome to our Facebook, Instagram Live. Come on and join us. Amber and I are going to hang out with you for a little bit. So call your friends, text your friends, tell them to hop on too. And if you happen to miss the live one and you miss the 24-hour one, you can actually, we'll be able to go on our YouTube site and watch it as well. So, louder. Okay. So maybe, can everybody hear me? Can you hear me? Just let me know. Is it on Facebook?
Yeah, there's one.
We're trying to make sure. Last time we had a lot of people say they couldn't hear us for a while, so we got these nifty little microphones here.
We're like news production.
Yep.
The RENU news.
Here we are, ready to give you some good news. Everybody hearing us better?
Yeah, it is.
Yes? Okay. So I can get it closer here. All right. So we're here today to give you some really good news.
Yes.
And actually, I'm going to move this since I'll be turning toward you, Amber.
That's a good idea.
And
Perfect.
then probably you can hear me better. I'm the loudest talker in the world, so I don't know why no one can hear me.
It's a first.
All right. And everybody out there, it's your job to let us know if we have lipstick on our teeth or anything like that. So,
yeah, please do. Please let us know.
All right. I think we've got some people there, so we're ready to start.
Yeah.
And here today, Dr. Barrett from RENU Medical Aesthetics, and we are in Stewart and Tequesta, and this is Amber Paprin, my nurse practitioner.
Hello.
She's mine, all mine.
All hers.
So today we're going to kind of chat with you about our RENU lift with Radius.
Very exciting.
You know, if you could do one thing all day long, maybe you don't have to pick Radius if you want, but if you could do one thing all day long,
what
would you do?
I would probably do filler because it gives patients that instant gratification and that lift that they're going for. And like we're going to be talking about, we don't age in one direction, we age in multiple directions. So there's just nothing like replacing volume and lifting everything in a certain vector that gives you that instant 5 to 10 years younger.
Right.
So that's what I would do. What would you do?
Oh yeah, hands down, Radius. I've been injecting Radius since before it was FDA approved.
Yes.
So hands down, Radius, because it's the happiness factor is amazing, and there's nothing like watching that patient. You know, we do half their face, then we give them a mirror, and watching them go, wow.
Yes.
You know, because they just didn't realize, and it's funny because no matter how many times they do it, whether it's their like yearly or they've been coming to me for 10 years or whatever, it's like you do that and they're like, oh,
this is what I used to look like. It's the same you, it's just you 5-10 years ago.
Don't you find, especially with COVID and everybody being home for so long, and a lot of people on video like this,
the Zoom meetings,
they come in and you do half their face and they're like,
I've literally had patients that have said that since the Zoom meetings, they saw themselves always looking, and it was just not a good angle or look for anybody. Park them right back up, a little bit of Radius, and
here they are, selfie, selfie, selfie.
Yes.
So we're going to talk with you a little bit. So RENU, what makes us different?
What makes us different? Okay, yes. Well, concierge, number one. We're not like your typical med practice that you're just going to see a different provider every single time, that it's a big turnover, that they just want volume of patients. We're about experience here at RENU. Secondly, Dr. Barrett, not to toot your own horn, but she's been doing this for about 20 years now. So she's, full-time, the absolute master. And when you're dealing with something that is so complex and artistry, that's something that you want to be looking forward to.
Yeah, it's I've seen a few things.
Yeah,
so
I'm sure.
I think that not anybody could pick up a syringe and start injecting. They can't take a course and do it. It's really important that you go to somebody who, number one, loves it, Number two, really has that artistic look. Can look at a face and say, ooh, a little bit more there or there. We don't have to draw vectors on, and lines and everything. It's just we're really looking at you, what makes you you. And
True.
I think, those kind of things, experiences and having the same provider and everything is just what makes us different. And we're honest about things. If you don't need something, we're not going to sell it to you. We're just going to, tell you what you need. And a lot of times patients come in and they think they need one thing and really they need another.
Yes. Well, they might have been Googling it, or maybe their friend had it, but really their problem could be geared towards a different modality altogether to give them that outcome that they're looking for. Happens a lot.
So tonight when we're talking, I really encourage you to ask questions, and you will be graded on this because we are doing a giveaway with skincare. Yes. So whoever participates the most is going to win. So ask those questions. It's really important. These are really educational seminars. We're teaching you about this. It's a very difficult field. There's a lot going on. So,
yes.
And there's med spas all over the place. So I think the other thing that makes us different is we educate our patients. They know what they're having done, why they're having it done. It's not like, oh, you're going to do what we say.
Right. We don't push anything. It's a lot about just education.
So the RENU lift is I coined that because, what are people looking for when they come in? They're always doing this, right?
Yes.
So they want to get lifted. And Radius and Xeomin is a great way to do it, like we said. And we're not saying that because we're talking about Radius, but we love Radius because
nothing gives you that bone, that same type of structure support like bone, like Radius does.
And then it's instant. It's a collagen booster. So Radius differs from any other filler, no matter what you're talking about. It is the only filler out there that actually will give you instant results and is going to stimulate your own collagen, which is huge.
Yeah, other HA fillers, after 12 months, it's gone.
Yeah, and I see it all day long. I mean, my patients I've been injecting forever. A lot of times when they come back next year, they're going to need less product.
They just look better each time they keep coming back.
Yeah, and their skin looks better because we're stimulating collagen there.
Yes.
So I think that Radius is a really great choice if you want a little lift. And, that lift, what does that do for you? I mean, it does a lot, right?
It does a lot.
We're not just talking about making cheeks.
No, it will help with your jawline. It will help with your neck. As we get older, our faces tend to just kind of morph into a neck, and then we don't see that really nice crisp jawline that we used to. So that's something that with this RENU lift is going to definitely do for you.
Yeah, as Amber gets older. So
you keep me young.
We're gonna watch her as she gets older. I can't wait. So it does, like, things that change as you lose this volume in your face. And I always show my little picture that nobody wants to see, but it's super important. So if you're looking at this on your left-hand side, this is our bone structure and our fat structure and our muscle structure when you're 30. And then on the right-hand side is actually age 50. So it's not like that old. I mean, I think 50 is middle age. So we see that, we see it as we change, and that's what we're trying to address. We're re-volumizing your face. And I think the biggest thing that people ask for, they don't come and say, oh, I want cheeks, and oh, I don't want this. They say what? They want to look.
They just want to look like themselves, just less tired. Or everything's falling. I hear that. That's the biggest one. Everything's just falling.
Yeah.
So we'll just lift it right back up.
Yeah. We've got a couple questions. People want to win this getaway.
The first question today is, what is the best for tightening the neck area?
For tightening the neck area. Okay. So we talked a little bit about when we lift. So like when we do the RENU lift with Radius, the really cool thing about it, and I always tell people, if you right now take your fingers, put them here on your cheek and your jawline, and I want you to look at your neck and then lift up and see what happens.
It does improve the neck, the laxity. Here, that laxity is going to go up, and that jawline will be crisper, which will help with the submental area.
So it's It kind of sucks it up. So when we fill you up here or do anything up here to lift, whether it's alt therapy or radius, a lot of times it helps your neck. But if you specifically want to talk about tightening for the skin of the neck, we have some great tools for that. So depending on if you have a lot of laxity and need lifting, you can do the alt therapy machine on there. And then if you have a lot of sun damage and you have laxity and you need just tightening.
And wrinkles and creases in the neck, that would be the cool laser all day long.
Yeah. And you do it all day long.
I do it all day long.
So the cool laser is a fractional CO2 laser that in the past had a lot of downtime. And now it's like lickety-split quick.
10 minutes, 24 hours of just, no working out, no sun, no swimming. After that, go back to your normal life. Just do 3 1 month apart, and all that would tighten up a lot.
So that's a really great treatment. So if you're wanting to do some neck tightening. And then the other neat thing that we've got is actually, speaking of radius, we can do what we call hyperdilute radius on the neck. And that's 1 syringe. It's 1 treatment. Possibly sometimes people need a second one, like at 8 weeks, but I think a lot of people get what they want from one. It's put in with a cannula, so it sounds weird to inject filler in the neck, but it's just a couple little pokes, cannula goes in, and instantly done. So
because
maybe 20-minute procedure.
Radius is a collagen builder, so it will build that collagen and help smooth out and lift.
And you get your instant gratification because you're going to get instant smoothing with it. So we've given you a couple things for your neck. Do your lift here, and that will tighten. You can do alt therapy to lift it. You can do the cool laser to tighten it, and you can do hyperdilute radius to inject into it. So we've got a few things to help you out with your neck. So we have another question. Go ahead.
Does radius build collagen?
Oh yeah.
Yes.
It is the only filler out there that builds collagen. Now, you can say Sculptra builds collagen, but it's not really a filler giving you instant gratification. It's going to stimulate your collagen down the road. Right. But the radius, yes, it will give you collagen. So when we do a RENU lift, people love it. I mean, I'd say if we had to pick what's our most popular procedure would be the RENU lift with radius.
Yes.
Second most popular procedure would probably be the cool laser.
Yes.
But when somebody comes in for their RENU lift with radius, what's involved? Like, how long does it take?
So maybe 5 minutes for pictures, and then you're going to get numb for about 10 minutes. It's a topical numbing, and it really does not hurt. In fact, most of my patients say that when they get their filler, their radius, it hurts less than Botox. Because Botox goes right into the muscle and seems to be more superficial where more nerves are. This goes right down to the bone and kind of just bypasses those nerves. So you're going to numb for about 10 minutes, and the procedure could take 15, maybe.
It just depends on the amount
just depends
you're
on
getting.
the amount, yeah.
So if somebody has not a whole lot of volume loss, I never do 1 syringe because it really takes, we want to do the cheek and the jawline, so you've got, 1 syringe up here, 1 syringe down here. So if they're doing 2 syringes, then it'd probably be in and out in 20 minutes. Now, if it gets more complicated, somebody's older, they've had a lot of volume loss.
Right.
I will sometimes have people that need like 4 or 5 syringes.
Right.
If they do that, we're going to do 3 at a time.
Right.
And then I like to bring them back a couple weeks later because it does cause a little bit of swelling because of the inflammation that builds collagen. And they come back in 2 weeks when everything's settled in, and then we build on that structural support.
Yep.
So when people say they're falling, it's because of that bone loss and structural support loss. I think we have another question.
And will filler to the mid-face area also help with under-eye area?
Oh, good question.
Oh, somebody knows what they're talking about. But yeah, so when we talk about the face, talk about upper face, middle face, lower face. And mid-face is kind of here, and when we do the radius, we actually follow your anatomy. I always say it's like an easy thing to do because we look at we inject little bits on the bone, and we follow your anatomy, and that's the reason it looks 100% natural.
Right.
So if you're going to lift that area, it actually helps pull out the under eye area and kind of tightens that a little bit. So if somebody's wanting under eye fillers, I don't know what you say, but most of the time I'll say, hey, let's get
Do
this
your
radius,
cheeks first, yeah.
cheeks first, and then let's see what we have going on under there.
Exactly.
So yeah, great question and great point to make, because that happens all the time. Somebody thinks, oh, under eye's the issue, but we pop those cheeks up and
it's that tear
great.
trough deformity really just smooths out a lot.
So, so you come in and you do your radius and you get your immediate gratification. You're looking like you're 20 years old and glowing and beautiful. And then the next thing we do is Xeomin.
Yeah.
So some of you go, Zeo what? Well, Xeomin, it's just a brand name for another type of Botox. So really there's about, I think there's four different Botox products right now. There's Botox, there's Dysport, there's Xeomin, and there's Jeuveau or Juno. Juno, we don't really use that one, so we don't know it. But you know, they all three have a little bit different characteristics, and but at the end of the day, it's just different brands of the same product. So
works the same way.
Yeah. So what kind of things about Xeomin do you think are neat?
So what I think is neat is that actually Xeomin is known for its purity. It has less additives and preservatives in it, so that's neat for people that have a lot of allergies. Second thing I think that is kind of neat is that with Botox, it will kick in at around day 7. This will kick in around day 3. So it's kind of nice to have.
That's huge.
Yeah.
That is huge. Yeah.
Yeah, when you paid all that money, you want to see it.
Oh yeah. If
immediately.
I'm going out of town and I'm, oh my God, I forgot to do mine. Or, you know, it's like, oh, I'm gonna pop my Xeomin in because I know that one. Usually for me, it'll kick in by that evening. So a lot of times it's just super quick kicking in. It is more of a pure protein, and that's nice for people who have allergies or are concerned about. You can develop antibodies to these products, which would mean they wouldn't work as well. It's not really that common, but it will be less likely to give you antibodies.
Yes.
So, another question.
What does Microtox do? And do you use it at the same time you do the fillers?
Okay. So Microtox is, and I'm going to go into that a little bit later. But Microtox is our RENU way of getting some very dilute neurotoxin, which would be like Botox, Dysport, or Xeomin, into the upper layer of the skin, which we call like the upper dermis. And what is it going to do? It's going to help constrict your pores, so it smooths your pores, and give you like a little bit overall tightening on the face. Now, the one that I came up with, our RENU Microtox, basically has hyaluronic acid in it and a growth factor in it, and then the hyperdilute neuromodulator, which like the Botox, and that little mixture is in a canister, and I'll show a picture of it in a few minutes, but it's going to deliver that liquid into the upper level of the face. So you will, over the next 7 to 10 days, whenever it kicks in, you'll see the smoothing of the pores and everything, but immediately you're going to get some gorgeous glow.
Glowing.
Yeah. So that's a neat procedure. Yes?
So which lasts longer in your opinion, Botox or Xeomin?
In my opinion, they all last the same round. Okay, so that being said, I've got a handful of patients where one lasts more than the other.
That's individual. I couldn't put money on one or the other.
No, I would never want to. In fact, I wish that I could just all day long not tell people what I'm injecting in their face, and just do Xeomin or Botox or, and just not tell them and see if they see a difference. I definitely think there are some people that do see a difference.
I do,
and I always say just try all 3 of them and see which one, and hope it's the ones that are cheaper, the Xeomin and the Dysport. That's really all you can do is try them all. However, my little rule of thumb, if you tell me whatever you're using, and I don't care what it is, you tell me it lasts over 6 months, then I usually say, maybe we shouldn't change it.
No.
That's kind of my rule.
Yeah.
Certainly if you tell me 10 months or a year, well, you don't want to mess around with trying another one, and then if it didn't last as long, you'd be pretty mad at me. So, but good questions. So I'm going to go through some before and afters here. So Amber, you want to tell us about this one?
Okay, So this one, she definitely did a neuromodulator like Xeomin, and she did radius, and I believe she also did the cool laser. Am I wrong?
I
can't
don't
remember
if she did a cool laser.
Only because I see a lot of tightening under her eyes, which might be.
I think it's
because
just,
from the
honestly,
radius.
Okay. I think she was really literally just radius and Xeomin.
Okay.
So you can see on her forehead, she's got some really beautiful smoothing.
Yes.
You know, and this is a picture at rest, so it's not asking her to lift her eyebrows, but at rest. And then you can see how on her cheeks, like she's lifted, and it just did whatever.
Look at the nasolabial folds. Look at her marionettes, and then you see everything just lifted up.
Yeah, so neat pictures, and we've got quite a few of these. This is our gentleman jawline here. So, you know, men love this procedure, jawline, and radius is, I don't care what you're going to tell me about jawlines, radius is the only thing that I like for jawlines. Even if I do Sculptra for volume, I still like radius in the jawline because it's just so distinct and definitive. Yes, it just gives you that beautiful little angle and really demarcates it nicely. And so he's had radius, and obviously he's handsome to begin with, but it just gives him that little more crispness to his jawline. And that's honestly what makes a man look youthful. Mm-hmm. They may not want to come in. A lot of times they don't care about their wrinkles or lines, but honestly,
they want a strong jaw.
Yeah, when they start to lose that definition, I call it where the face and the neck, like it's face to neck, you can't tell what's what. That for sure, you got to throw some radius in there and just start looking at that. So combination therapy, you know,
that's the best way to go.
All day long, right?
Yeah.
So what are your favorite combinations of
I would probably say filler, radius, the cool laser, and alt therapy. If I had to pick, well, of course your neuromodulator, but that's always like a given.
That's like a trifecta.
That's a trifecta.
The neuromodulator, we don't
even count that because it has to be done. It's just like a thing. Like you have to pay taxes. You have to do your neuromodulator.
You need those like wrinkles be gone.
You need to
all day long. That's the other thing coming out of COVID. Well, we're not out of it yet, but I mean, it's like everybody's rushing in for their neuromods. Their lines are so deep, and they're like
stressed out.
It's nice. So yeah, I think that is the best thing. So if somebody came in and they have all the money in the world, and they could do anything, I just say, here, we're going to get you in the alt therapy room, and we're going to get your alt therapy done, single treatment, lasts 2 to 3 years. You're going to get lifted. Then you're going to come in and see me, and we're going to pop some radius so you get your instant gratification while you're waiting for that. And then you're going to run into Amber, and you're going to do your RENU Cool Laser right on top of that all.
You can do it all the same day.
All the same day. And then after that, you're going to pop right out, and one of us is going to throw in some Botox.
All over.
Or right there to stop your... I mean, it's like...
We could do it all in the same day, one-stop shop.
So come and get that. We love it when people do that. It's amazing. And they love it, too.
Yes.
They look amazing. Yes, you have a question.
So the cool laser, should it be done before or after Xeomin and radius?
Good question. So you can do it immediately after radius, and you can do the Xeomin immediately after the laser. So radius, laser, Xeomin. Now I think there's some providers that don't worry about like that spread that's going to happen. But if you're doing the frown lines, you don't want to drop somebody's eyelid.
Nope.
I mean, most of the time it's not going to happen.
Yeah.
But, you know, you don't want to risk it.
We always err on the side of caution here. Yeah. Safety first.
So same day, get your instant lift, instant gratification, get your laser to start smoothing and tightening, and then go ahead and get your Xeomin. Pop, pop, pop. So, yeah, that's the way. So she has done, our person up here, has done radius and her lips. And she was so excited about this. And, you know, if you look at her picture, her before picture, you say, oh, yeah, she looked a little tired, but she's really a gorgeous woman, and she's beautiful. And all day long you'd say she's beautiful. But here you add these few little things. You do a little radius to give her a little cheek volume and put some volume back on her face and help her jawline a little bit. And look at what happens under her eyes. Gets a lot smoother. Her eyes look brighter.
Yes.
And, you know, then we add her lips there, and bam.
Don't forget the lips.
The lips are like the icing on the cake.
Yeah.
Really.
Yeah.
I mean,
people don't come in wanting it right away. They want to be lifted, but then once they're lifted, they're missing that.
They are, yeah. They can be completely flawless, but if you don't just a little perk, like we're not talking wowza lips. I mean, she's got just nice, full, not too full, just, age appropriate lips.
Yeah.
And smoother, brighter, and she's happier.
Yeah.
She was ecstatic, but she's, like I said, she's gorgeous to begin with.
True.
So then we have Radius and Xeomin and lips.
Plus lips.
Nice trifecta there.
Yes.
So she has a Radius, and again, you see that under the eyes. We didn't put anything under her eyes. So we've got the Radius that just gives her back that cheek volume. And when we say cheek volume, we're not talking this.
No,
because I think
anterior inflated.
Because I think sometimes people, and I don't see it as much anymore, really.
But
a lot of people, when they
for a little, those apple cheeks, was awful.
And I don't know that it was popular in that. I think that's just how injectors were injecting at the time.
It was not good.
They're like, okay, let's lift them up, but it's really, that's not the place to put it.
Yeah.
Really have to start out here, because if you start out here to get your lift, then you don't need as much here. Because as we age, we looked at those fat pads, they drop down. So if you can just elevate those up, you've got your volume back right away.
Yeah.
So she had the Radius, and then she had the Xeomin, which really smoothed everything out.
Yeah.
And we're showing these pictures at rest, so it just shows you how taut and smooth. And then she had her lips done, which hers were very,
very
just
small.
Yeah, just needed a little more, bottom lip, and just
perioral lines.
Not much.
Smooth that out.
So, and everybody's different, and we do a lot of talking, talk to our patients. What do you want? What are you looking for? Show me a picture. Sometimes I have them bring a picture, an old picture. That's a nice way to do it. So this is another person that, again, looking pretty beautiful from the get-go.
True.
And why don't you talk about what you did for Chris?
So this is the Radius. She just needed a more volume. If you look at her mid-face, you can actually see that she's beautiful, but just a little bit gaunt, and that really ages us. So when you put that volume, and then put that volume even in this vector, this fat pad that, like you said, falls and starts to diminish over time, it really, that youthful, full face, what we like to call little lollipop heads. If you look at like youth, like when you look at a toddler, it's just a little body and then a big old head. We call them lollipop heads. So as we age, we start to become more gaunt in certain aspects. And if we could just get that volume back to where it was, you immediately take 10 years off.
Yeah, and she's somebody too, she had lost some weight. And a lot of times when people lose weight,
in their face.
It goes whoop right out of their face, and
not
she
their bellies.
stayed nice and skinny. Right, yeah.
Unfortunately.
So it's like, you lose weight, and then you're like,
then you look,
my body looks great, but then what happened to my face?
Exactly.
So we can just, put that volume right back where it needs to be without you having to gain it back on your body.
Yes.
So really a beautiful, and I think you'll find like all these patients, they are before and afters, they just look refreshed. They don't look overdone. They don't look abnormal. And I know a lot of patients come in and they're really afraid.
Yeah, they think they're going to walk out like a Picasso or something, Like, I don't want to change anything. It's like, you're not going to change anything.
They're going to be like parts
just,
sticking out
it's
and
weird.
Disproportionate and
look odd. It's just going to look like you, just 10 years younger.
And everybody's, there's different providers for different people,
Sure. Absolutely.
A lot of times if people want to look disproportionate and strange, they won't, have an easy time with me. Whereas there's some providers where if you want to look natural, you might not have an easy time with them. So
that's true.
But there's somebody for everybody. So this is another jawline, so Radius jawline, and she actually was a model for us, and she actually does permanent makeup. This is Karen. She does permanent makeup in our Stewart office. And I've been trying to get her to do this for forever, and finally she said, yay, I'm going to do it. So really nice cheekbones, and Amber did a great job with her. And look at her jawline. Her jawline, the definition is just amazing there. And she was happy, and
super happy.
Again, eyes look brighter. I mean,
Yes.
you can even see it on the side view.
Oh yeah, you can see it on the
When
side
you
view.
frame that, I mean, when I first started injecting Radius, like way back, probably 15 years ago or something, that was the first thing every patient, I'm like, why does their eye look like, wow?
Yeah, really pops.
It really pops, and I didn't do anything to it. It's just that framing, that nice frame. It's like you can have the most beautiful thing, and if you don't have it presented the right way,
100%.
Yeah. So, and here we've got some Radius, Restylane, Define, and Xeomin. So what we've done for her, we've lifted her up a little bit, and she's got pretty good volume, and she's aged well. So she just needs a little bit here and there. And then we did the Restylane Define a little bit in her lip and around the mouth. So when we get to lines around the mouth, you can do Radius there, but
we prefer
a
Restylane product. You just have more elasticity in that product. I could sneak it in your marionettes. I could sneak it in your nasolabial folds. I could sneak it in your lips. So it's very just fluid in that regard.
It's more versatile.
Yeah.
It's safer, I feel. I mean, Radius is safe, but sometimes it's just like too heavy for that area.
Yeah, too heavy.
And you could do some, nice structural bone support with it, but when you want to get it, like you said, it's the movement. The Restylane products are much better for that movement.
Yeah.
So, and that's the important thing too. You want to go somewhere where they have all these different products. So, speaking of which, our new favorite.
Oh yes.
Restylane Kiss.
I love it.
Yeah. It's been really nice for the lips. We've had
very
it.
versatile.
Has it been 2 weeks, 3 weeks?
It's got to be 3 weeks now.
Yeah, 3 weeks. So. We've done a fair amount of lips with this, and it just does not disappoint.
No.
It's really soft and fluid and versatile because you can pop it in little, very thin etched lines, but you can also give volume.
Yes. I'm very surprised at the amount of volume that you get from a product that I could then put in a perioral line, which you need to stay very superficial with. So I've been extremely happy with this product, and I think you will be too.
And she's wearing it.
And I have it in my face now. So, and another cool thing about this is that they are saying it's going to last in the lips for a year. Now that's a little unheard of because most HA fillers don't last quite that long. Up to, some do, but usually a little bit less.
It'd be interesting to see because I would think a lot of my patients go like 8 to 12 months with theirs. So it'll be interesting if they're saying a year. It'll be neat if it lasts even longer than a year. I mean, lips are not the easiest place to inject.
No.
So as far as discomfort. So if we got something that lasts longer, that's going to be
better for you guys.
Yeah. But so far we like what it does.
Yes.
We've got our RENU Microtox, and I think I told you I would show you what it is. This little guy right there is, that's what we mix everything in, and then it just, pop it on the face. It's pretty, it takes like about 15
minutes, just like a microneedling, but just more superficial.
Yeah, so you just don't want to wash your face.
No. Right
after. The next day you can wash your face, put makeup on, and you have this beautiful, glowing, hydrated skin, and it's just really neat. And then it's going to even get better over the next 3 to 7 days.
Yeah,
so,
when the neuromod kicks in.
Yeah, so it's a great little thing we're doing, the RENU Microtox. So that's kind of new for us. So summer specials. Any of you that you don't know, we do our RENU Pons every Tuesday. So like yesterday, we just had our Brow Lift RENU Pon, which it's a single treatment, lasts 2 to 3 years. We did it brow lift combined with a little bit of lift of Botox, and that was $650, and that normally would be like $800 for that. So so that was nice, but it's over. Sorry.
Yeah, just 24 hours.
Yeah, the way these work is every Tuesday we will send an email, we will send a text.
It's everywhere.
Put it on Instagram, we put it on Facebook, and then you have 24 hours to call us up. Even if you call in the middle of the night or email in the middle of the night,
still counts.
We're gonna, still counts. You'll still get it. So, and then you have to use it by October 31st. Yeah. So that's our way to have our fun, summer specials. I think I've been doing this for, I want to say 4 years or 5 years, and now people just if we send it out a little late, they're calling up going, "Where's the RENU Pon?" And And then we're going to continue to do these little webinars. It's going to be the 2nd and the 4th week in June, July, August, and September we'll start our seminars again.
Yep.
So we're sitting in front of our beautiful theater, 40 empty seats because we've got Hans sitting there. So we hope to be filling those seats in the fall. We have one more question.
Yes. For tightening your skin, which is better, all therapy or the RENU Cool Laser?
Tightening.
So RENU Cool Laser
Yeah.
for tightening, yeah. When
Yeah.
you're talking about lifting, that is the alt therapy.
But when you want tightening, small pores, pigment, fine lines, wrinkles, it could even go safe infraorbitally, so right under here for all that eyelid skin that becomes lax over time. Tightening, that's the laser. That's the #1 gold standard in skin resurfacing and has been for the past 30 years. So it's a great tool. This is something that's going to smooth it out.
Yeah, it's been just such a game changer because
total
of the
game
downtime.
changer.
Because before it was like, it was the gold standard. I told everybody, you got to have it. And not many people would do it because it's 7 to 10 days downtime.
Yeah.
But this is 1 to 2 days of redness.
But after 24
Out
hours,
and
you go
about.
back to your life.
Yeah, 24 hours and you're wearing makeup.
Yeah.
So, yeah, it's great. All right, well,
Okay.
we're going to sign off unless you have any other questions. And we will look at who participated and we'll announce who got our little
Yay.
prize. It's going to be a little skincare package. So the #1 thing that you should do is run to us and buy sunscreen because it's summer now. And
Skincare.
I had a lady today. She lives on a boat, and you know, when
You
she
got
was
her
here
on it.
last, I told her get on medical grade sunscreen, and she told me it has made such a big difference. That was like the only thing she did. She said, I already see my skin looking better.
Yes.
It's amazing.
Got to prevent
So
that damage.
it's summer. Get your sunscreen. We have the best ones.
Yes.
And they're not super expensive. They last a long time.
Very much.
Work great.
Yes.
And then if you want to come get a consult for a RENU lift and find out what your RENU lift is, come on in. Just give us a call and we can get you in to see Amber or I in Stewart or in Tequesta. And I want to thank all my patients. I always show these before and afters, and you know, these are real people with real lives, and I just want to thank them.
Yeah.
It's really nice of them.
Really, really nice.
Yeah, because they're doing this for education so that you
Yes.
can see what the difference is, and then you're more comfortable with things. But thank you, everybody.
And don't forget to join us in 2 weeks.
2 weeks. We will see you then, and look for our RENU puns. And we will see you later. Bye.
Bye.